chest, and it will be forming the shoulder girdle, also bone of the shoulder girdle. So the type of the scapula, and you know the type of the bone? Flat bone. However, it has so many irregularities, but it's considered as a flat bone. And then for the anatomical parts and features. So for
you see the side, this one is at the back, is it? How do you see the side?
back of the chest.
Back of the chest.
Okay, for the parts and features, so we have 6 multiplied by 3 because we have 3 processes, 3 borders, 3 notches, 3 angles, and 3 tubercles, and finally we have 3 fossae. So we have 6 multiplied by 3. So first we'll start by the 3 fossae. So we have here subscapular fossa will be in the anterior surface here, very big fossa, and then we have the supraspinous fossa at the back and infraspinous fossa. Okay, and then for the 3 borders we have here the medial border, lateral border. At the lateral border there will be the glenoid cavity here. Okay, so lateral border, medial border, and then we have the upper border. Okay, then we have the 3 processes. So we have the coracoid process, acromion, okay, and we have the spine of the scapula. We have also 3 tubercles: supraglenoid tubercle, infraglenoid tubercle, and tubercle of the spine. Then we have also the 3 notches. So here we have something called the sphenoglenoid or acromioglenoid notch. This one here, acromioglenoid notch, and we have also the circumflex scapular notch here. Okay, and we have also the suprascapular notch. Okay, so we have 3 notches, and we have also 3 angles, which will be the inferior angle, and then lateral angle, and the medial angle. So how many we mentioned now? We mentioned all? 5. Right. So we mentioned the fossae and the spines, and I mentioned the fossae and the processes and the notches and the tubercle and the borders and the angles. Actually, we mentioned the 6. Okay. 6. All right. So how to know right from left? Also 3 points. 3 points also. So first, the subscapular fossa, which is the big fossa, must be anterior. Okay. Then we have the glenoid cavity here, must be posteriorly. Okay. And finally, we have this one angle, must be below, directly downward.
Glenoid posteriorly or laterally?
Glenoid laterally. Okay. So subscapular fossa anteriorly, the glenoid laterally, and the only one angle, which is the inferior angle, must be directed downward. So those are the 3 points to know. So this one is right or left?
This is the left.
Left scapula. Okay.
This one?
They are easy to recall. So first we go by the fossae. So each fossae will be having the name of the muscle will be named by the fossae. So subscapular fossa, subscapularis muscle here. And then supraspinous fossa, supraspinatus muscle, and then we have infraspinatus. Then we go to the borders. So we have here the lateral border, and we have also the medial border. Okay. For the medial border, there are attachment to the anterior and posterior surface. So attachment to the anterior are going to be the serratus anterior muscle. Okay, so basically this muscle will come from here and insert it into the medial angle. See, okay? The muscle come out from the rib and they are inserted here to the medial border. Okay, this one important to know because during the clinical importance you are going to mention about the action of the serratus anterior. The serratus anterior insertion, they are going to be not organized equally. So what happened that most of the muscle will be inserted into the lower part of the border. Okay, so you can see that first 3 are going to be inserted in a major part, and the lower 5 they are going to be inserted in the lower one third. Okay. For the posterior surface, they are going to be insertion for 3 muscles. So we have here the spine of the scapula. So above they are going to be levator scapulae. Then here, in just opposite to the spine, will be the rhomboides minor, and below will be the rhomboides major muscle. Okay. Levator scapulae, rhomboides minor, and rhomboides major muscle. Okay. Because those muscles actually they are coming from the back. They are coming here from the back. They arise from the spinal, the vertebral column, and they are inserted here. So levator scapulae inserted here, then rhomboides minor here, and rhomboides major here. Okay, those are muscles of the back. Okay, then we have the muscle attached to the lateral border. So for the lateral border, we have 2 muscles. We have the teres minor and the teres major muscle. However, the name is teres minor, but it comes out from the upper 2/3, and teres major comes out from the lower 1/3. Okay, all right. So those are the attachment to the borders. Now, attachment for the processes. So we have here the coracoid. The tip of the coracoid gives origin to 2 muscles, the coracobrachialis and the short head of the biceps muscle. And for the medial surface here, they are going to give attachment to the pectoralis minor muscle. Okay. For the acromion will be giving attachment also to trapezius and deltoid, as we mentioned in the lateral 1/3 here of the clavicle. Why? Because it's like continuation of insertion and origin. So we have here for the acromion, we have the lateral border and medial border, and you can see that the medial border they will be continuous with the upper lip of the spine, and the lateral border they will be continuous with the lower lip of the spine. So here they are going to be the attachment of
trapezius.
And here the
Deltoid.
attachment of deltoid. Because actually I cannot fit this one here, but try to imagine it will be like this. We mentioned before that the inner border here, right, give attachment to trapezius, right?
Trapezius.
The posterior border here give attachment to the trapezius. So trapezius will go all this line. So the posterior border of the lateral 1/3, and then the medial border of the acromion and the upper lip of the scapula. All those will be trapezius, go up. For the deltoid, from the anterior border of the lateral 1/3, and then from the lateral part of the acromion and the lower lip of the spine. This one giving the deltoid, which will go downward to cover the tubercle. For the attachment to the tubercle, so supraglenoid tubercle, long head of the biceps, infraglenoid tubercle, long head of triceps. Okay, so those are the important muscle attachment. And for the articulation, basically we mentioned before the acromion, from the acromioclavicular joint, acromion with the clavicle, and this one will be with the head of the humerus. They are going to form the shoulder joint or glenohumeral joint. Okay. Now, for the clinical importance of the scapula, the first important one will be the winging of the scapula. What do you mean by winging of the scapula? Means that the medial border will be retracted. Okay, means that this part here are going to be pushed backward. Why push backward? Because the muscle attached from anterior of the medial border, which is the serratus, paralyzed. Why paralyzed? Because of injury of the long thoracic nerve or nerve to the serratus anterior muscle. So injury of the nerve here lead to paralysis of the muscle. So this part will be retracted. How to test that there is a problem with the long thoracic nerve? We ask the patient to push against the wall. We try to activate the muscle. But what happened that the muscle is not functioning? So you can see that the scapula will be winging. So we call winging of the scapula. There is here part we mentioned, we call the suprascapular notch. Suprascapular notch actually in our living human body, it will be closed by ligament. We call the suprascapular ligament. They form the suprascapular foramen. So this one important, Professor Jit may ask this question. There are suprascapular artery and suprascapular nerve. Which one pass through the foramen and which one pass through above the foramen?
Maybe below the bridge.
The nerve, I think.
Nerve below.
The nerve pass above the ligament. Because always remember that navy above the bridge, navy below the bridge, navy below the bridge, army above the
Army
bridge.
below the bridge.
So the army above the bridge, army means artery.
Oh.
Okay, so the artery pass above the ligament, but the nerve, the one will be passing through the foramen. So army above the bridge.
So artery is
Above.
nerve is through the
Nerve pass through. Okay, and here we mentioned that we have circumflexus scapular notch. This one will be for circumflexus scapular artery, which is a branch from the third part of the axillary artery, very important for anastomosis around the scapula. Okay, this one important because it may provide connection between the first part of the subclavian artery and the third part of the axillary. So in operation, when you want to ligate the subclavian artery, make sure that you don't ligate the first part, you ligate the third part, and you do not ligate the third part of axillary. If you want to control the bleeding, you ligate the first part, okay, to avoid, to allow the anastomosis around the scapula to supply the upper limb. Okay, so those are the important parts here about the scapula. First, you decide. After that, you explain. It doesn't matter. But first, you make sure that you have already know which is right or left. Then you try to explain. Okay? It doesn't matter how you explain. Actually, you can mention too many things. I can mention 10 things to know right from left. But I prefer my own 3, right? And you can get your own 3. But the most important that you know. So, for example, the question will be like this. Can you tell me this one is right or left scapula?
This one is left scapula based on the 3 point. The subscapularis fossa will be facing anteriorly. The angle of scapula will be facing downward, and the spinous process of scapula usually is posterior. And the tubercles is tubercle will be
Cavity.
facing laterally, and the medial angle,
Medial spine.
Medial-
Medial border.
medial border will be facing medially.
So you have mentioned 5 points. You can explain the both subclavian and the third part of the axillary. So the first part of the subclavian will be giving 2 arteries, the suprascapular artery and also the transverse cervical artery. And the one come from the third part of the axillary will be 1 artery. They give the subscapular, which give later on the circumflexus scapular, which wind around the scapula like this. So basically, when there is an occlusion in the last part of the subclavian or the early part of the axillary, so this anastomosis around the scapula provide blood supply to the upper limb. So in operation, you can occlude the second or third part of subclavian, no problem, but do not occlude the first part. You will cut the blood supply from the upper limb.